Hello, I'm Shelley Irwin. Thank you for joining us today for Family Health Matters. We're live in studio talking about heart disease. Feel free to call in with your questions or comments. Of course, those numbers will be at the bottom of the screen throughout. Our guest today, let me introduce the distinguished panel from the Heart and Wellness Institute, Dr. Parina Manohar. Dr. Manohar, thanks for being here. From the Borges Cardiology Group, Dr. Vishal Gupta. And from Borges Sleep Disorders, Dr. Mark Getting. Thank you for joining us. Here we go. Correct me if I'm wrong. Heart disease is the #1 killer of men and women?
This is true, both for men and women. It continues to be our #1 killer. But an important piece of information is that about 85 to 90% of heart disease is preventable.
So how much does what we eat matter?
A lot.
Yeah.
I think starting from cholesterol to just high carbohydrate intake, can lead to diabetes and high blood pressure, which can in turn lead to heart disease. So I think a diet is probably one of the key parts of heart health.
Dr. Manohar, let's talk women. Why such a high number for the killer of women?
Well, a few reasons. One, until recently, there wasn't very much emphasis at all put on the fact that women are so susceptible to heart disease. So women didn't know what to look out for, not knowing the signs or symptoms, both if you were in the lay community and being more aware of it in the medical community. That knowledge was very important, first for recognition. And then second, there are some aspects to heart disease where women do not respond the same as men. And so to know what the incidence is more for heart disease, the types of heart diseases you were mentioning that affect women are different than for men. So both that community knowledge as well as the medical knowledge.
Hi, caller. What's your question, please?
When I was younger, and all my life, I rode a bicycle all over town. I was always extremely healthy, never had any problems. And in 1980, I married a smoker. Can you hear me all right?
Dr. Gupta, I trust she's wanting to know the effect of secondhand smoke on her life?
I think secondhand smoking is probably just as bad as smoking, because the ingredients in the smoking, you inhale and then you exhale out most of it. And if the second, if you're in an area where there's a heavy smoke, I think you're going to have similar effects on your heart because of secondhand smoking.
Let's just get this out of the way. Smoking is probably, I've even heard of third-hand smoke these days, yeah?
Yes, and a couple of points to that regards. There have been some studies looking at smog and pollution in cities and risk for heart disease, with the correlation between the levels of smog and pollution and the incidence of coronary artery disease. Second thing is that, this is not gender neutral. For women, there is a significantly increased risk of developing coronary artery disease event, 17 times more than compared to men.
Our caller, what's your question, please?
Yes, I'm actually interested in some information. I have a 12-year-old grandson who has had chest pains. He was on Concerta for ADHD, and they took him off it for a few months. They did an EKG, and that was normal. So then they put him on Adderall recently. And I'm just really deeply concerned that they haven't done further testing on him. Heart disease runs in our family. My father died at 47 from congestive heart failure. I am 51. I've had 3 heart attacks.
All right, there's a familial issue, Dr. Manohar. Yeah.
A few things. First is I would recommend that you discuss this with your family doctor and get further evaluation. But there are many sort of beginning screening tests to evaluate not just a EKG, but an echocardiogram or ultrasound of the heart is a wonderful way that is non-invasive, and just sound waves to be able to look at the structure of the heart, and is a great starting point, but definitely important to have that conversation with your regular doctor.
Yeah. What's your question?
My question is this. I just had a physical. During the physical, we noticed differences on my EKG. I was sent, and I complained about having night sweats, pain in the chest. I do take, I am diabetic. I do have hypertension, and I'm overweight. I don't smoke. My mother died with coronary heart disease. So I had a stress test, and I had some other things some other tests, and they came back normal. But I'm still having the pressure and the burning in the chest, and still have the night sweat. And I'm wondering, what should my next question be?
Response to our caller?
Yeah, a couple things. One to keep in mind is, as we know, many people have had stress tests before, yet we hear that they've either dropped dead or had a heart attack, and not for that high concern for the caller, but just for that information to be out there, that stress test being negative just means that you do not have, with high likelihood, severe coronary artery disease. And that's about 15% of heart attacks. The remaining 85% are really these mild plaques that get inflamed and then have clot formation on top of them. Those are the majority of the heart attacks. So it is important to have that chest pain evaluated. Second thing has to do back with the topic of sleep apnea. And again, you know, we should not make light of this condition. It is very significant. Repeated low oxygen levels that are seen in sleep apnea have very significant effects and can lead to things not just like high blood pressure, but also things such as congestive heart failure.
Yes. I walk into your office and say, Dr. Manohar, I want to prevent heart disease. What's your answer?
I would do one of a few things. Number one, you know, we were talking about you are what you eat earlier on today, and I think that makes an enormous difference. First, know what your risks are. Part of the calcium testing and other types of testing can help assess the risk. Second, target your risks so you can specifically lower your overall cardiovascular risk factors, whether that's eating, exercising, stopping smoking, watching things like blood pressure, cholesterol levels, sugar levels, and then reassessing on a regular basis to see how you've done with that overall risk.
What are the latest numbers when it comes to how much exercise I need weekly?
30 minutes every day would be wonderful, at least 4 to 5 days out of the week. And there have been studies that have been done looking particularly, say that you come in, you don't have any coronary disease. If you do a half an hour of brisk exercise, brisk walking every day, for every day that you do it, you have a 10% risk reduction in having a heart attack. If you get to day number 7, that's a 64% risk reduction. That's more powerful than aspirin.
Yes. When's a pacemaker indicated?
A pacemaker is usually put in patients when they have either a very slow heart rate, or if there's a disconnection between the top chambers and the bottom chambers of the heart to give the bottom chamber the adequate amount of beats.
From you, caller. Hi. What's your question? Thanks.
Yes, I have a question. I have two. I had a hysterectomy, and now I have this belly fat that I'm trying to get rid of. Could you tell me how do I go about trying to take care of that?
Dr. Manohar.
There's a few different ways. First of all, you know, if you can decrease the total amount of carbohydrates in your diet, that will help tremendously. Second, if you can increase the amount of movement you do every day, you don't have to say, you know, the bad E word if exercise is the evil word for you. Just moving. Whenever you can move, choose to move, and do it very regularly. And then lastly, when you do your movement, if you can focus it in the central abdominal area, for example, sit-ups, that will also help. So decrease carbohydrates, move when you can, focus on abdominal
I was
exercises.
looking forward to spaghetti and bread tonight. Do you worry about childhood obesity? Question for all three of you. Dr. Gupta.
Yes, I think. I mean, we've seen a big movement towards preventing childhood obesity, and from the First Lady itself, you know, she has sort of made a commitment to reduce it by 2020, and I'm hoping that it'll definitely in the years to come prevent both diabetes, hypertension, and heart disease if we can prevent childhood obesity.
And kids with sleep problems, could that turn into an adult disorder?
Yes, obesity is a very important issue. It's the #1 public health issue, really. While it's true that heart disease kills the greatest number of people, the factors associated with obesity, you know, diabetes, hypertension, cholesterol, and other lipid abnormalities are the substrates for heart disease.
Dr. Manohar, how much does stress matter in our life?
Oh, a tremendous amount. You know, just to give numbers that hit home, for somebody who has significant stress in their life where it's altering their everyday activities, you almost double your risk for a heart attack. And just as significantly, if you learn to manage that stress through everyday dedicated therapy, whether it be meditation or other things, yoga, tai chi, you reverse that risk. So very important to pay attention to that.
Yep. All right. What's my take-home message when it comes to prevention of heart disease, please?
One, know your risks. Go see your primary care provider and get an assessment what your overall risk is. Number two, make an action plan with your primary care provider of what you are going to do, whether that means exercise, diet change, stress reduction and management. All of those are very important. And number three, reassess regularly.
Add one extra one?
Exercise.
Yeah. And get a good night's sleep. Thanks for your time.
Thank you.
Thanks for your questions. Take care.